Welcome to the Feeding Children with Special Healthcare Needs module. This brief module is offered as a complement to early care and education college courses that cover health, safety, and nutrition. It is not meant to be exhaustive, but simply highlight important best practices and key information, as well as provide you with additional resources. There are some situations where a child might need to avoid certain foods, receive medication in their foods, or require an adjustment in the manner they are fed. In this module, we will review food intolerances and strategies for managing food allergies. We will also review children with signs and symptoms of neurodiversity, including autism spectrum disorder, or ASD, knowing that many of the adaptations that support their needs can also be helpful for other children with or without a formal diagnosis. We will also touch on adaptive equipment that may be useful to consider and medical diets to help you prepare for an experience with a child who needs greater dietary modifications. As with every child in your care, we encourage you to see the child first, celebrate their unique qualities, and create opportunities for their individual growth and development. I'm sure you are at least a little bit familiar with food allergies. Like other kinds of allergies, these occur because the body is mistakenly reacting to a protein in certain foods as if it were a virus or a bacteria or some other harmful invader. This is an overreaction by the immune system and in some cases can be life-threatening. By contrast, a food intolerance involves the digestive system and occurs typically when a child has trouble digesting a certain food. So even though both involve food, they are completely different systems in the body that cause the reaction, and thus the symptoms, experiences, and treatments are quite different. Let's look a little closer at the differences between preferences, intolerances, and allergies. While each of these conditions is important to plan for and manage in your childcare setting, food allergies are the reactions that can be life-threatening. Because of that, we'll spend most of this module covering how to manage food allergies. Supporting children in learning to try and accept new foods is the best way to manage food preferences and ultimately food choices. While it's important to trust that children know what foods they like and what foods they don't like, it's also possible to help them become more relaxed and adventurous eaters. Utilizing the child's health team, your early childhood mental health consultant, a behavioral support specialist, occupational therapist, a school psychologist, or social worker may also provide any needed support for a child who may have behavioral concerns related to food. Food intolerances occur when a person is not able to digest a certain food or component of a food. For example, lactose intolerance is when a person is unable to digest lactose, the naturally occurring sugar in dairy products. It can lead to unpleasant symptoms such as stomach bloating and diarrhea. For intolerances, food intolerances are not life-threatening in the short term, but still require careful management to keep the child healthy. Food allergies, as stated previously, are an immune system response and can range from mild to life-threatening. Let's go over the basics of how to care for children with food allergies. One of the most important steps in caring for a child with severe allergies is to prevent exposure to the food they are allergic to. A child's parent can request a special diet statement from their healthcare provider that helps modify the child's meals and snacks. This statement communicates to your childcare program what foods the child should not eat and which foods may be substituted. For example, a child with a peanut allergy may not be able to eat peanut butter, but may substitute with sun butter made from sunflower seeds or other substitute. Please note, some children may be allergic to both peanut butter and sun butter, so it's important to follow the specifics of the special diet statement. Prevention is key, and keeping the child away from the food they are allergic to is critical. A person can be allergic to any food, but there are some that are much more common than others. According to the U.S. Food and Drug Administration, milk, shellfish, fish, soy or soybeans, peanuts, tree nuts, eggs, wheat, and sesame seeds are the 9 most common allergens. It's important to know and recognize the symptoms of an allergic reaction so you can provide quick treatment and seek medical attention immediately. Coughing, difficulty breathing, swelling in the mouth or throat, hives and vomiting or diarrhea are all symptoms to watch out for. If you notice symptoms, enact the child's emergency care plan and call 911. Another important step in caring for a child with food allergies is to prepare for an emergency. The child's family will provide documentation from the child's healthcare provider, which is called a severe allergy emergency care plan. This plan will help you understand what food the child should not eat, the severity of the child's reaction, as well as the recommended actions for an emergency. Children's allergic responses can vary widely, and the emergency care plan can help clarify what needs to be done to keep the child safe. In severe cases, a child may go into anaphylaxis. This is when the allergic reaction involves multiple organ systems and is potentially life-threatening. You or your team members may need to administer an epinephrine auto-injector, or EpiPen, or other rescue medication. Having these medications on site is critical, and the emergency care plan will have the details of when and how to use this medication. Let's discuss children with neurodiversity and other health-related conditions which also relate to feeding children in your care. Children with autism spectrum disorder, ASD, may have very mild to severe preferences to food texture, appearance, or taste, just as they might be sensitive in other areas of the classroom. They may also have side effects to medication that may cause changes or decreases in their appetite. Because they may be unable to tolerate some foods or even whole food groups, children are at risk for developing nutritional deficiencies that can impair their health. As a childcare provider, your role in supporting the special dietary needs of children with ASD or any neurodivergence is important. Start by learning as much as you can about each individual child's current capabilities and expectations the family has for the child while in your care. Every child with neurodiversity is unique and will need an individual approach. Work with their family, healthcare provider, therapist, and your child care health consultant to ensure each child's feeding plan meets their nutritional needs as well as their sensitivities. Most importantly, create lots of opportunities for two-way communication with the child's family, and when you have permission, with the child's healthcare team. They will give you lots of clues about the situations and strategies that are most beneficial for the child, as well as key stressors or triggers. The child's healthcare team will also be able to offer strategies and support for your setting that might be new or different from what the child has experienced previously. Your partnership and patience will help children with ASD continue to engage and make progress at mealtime. Just as you would be flexible and supportive with a child as they are learning to explore at the texture table, being flexible and supportive at mealtimes promotes children's emotional regulation, including children with ASD. What strategies can you adopt that will help you remain calm so you can in turn support the children? Use the child's strengths as a starting place and limit the things that may add to their stress or overwhelm them. Again, have patience and recognize where you can be even more flexible. There are some simple things that are likely to be helpful for children with neurodiversity that may also be helpful to other children in your care. Many children benefit from a consistent schedule with predictable and supportive transitions. Offering choices, keeping the interaction supportive, and keeping your energy relaxed and ready can help the child to stay calm as well. The child's family and healthcare team may offer suggestions like using divided plates or other mealtime supplies that can help. Follow the child's health team's plan to ensure good communication and the proper care. Understanding a child's special diet will ensure safe and successful mealtime participation. This information is typically obtained during the enrollment and on the child's general health appraisal. Use this information to plan and communicate the best options for children and their feeding while in your care. There are some health conditions for which special diets, sometimes called medical diets, are required to ensure the child is adequately nourished. Not all serious health conditions will require major dietary modification, but these listed are some that do. Sometimes the condition requires medical modification to the foods, and sometimes specific foods are allowed or not allowed, or the timing of meals could be modified. Obtaining these special diet statements during the enrollment will help you best plan for successful meals with children once they arrive on the first day. Working with your dietary staff, kitchen, or food vendor will support you and your team. Some children in your care may require feeding and sometimes medications through a gastrostomy tube or G-tube. This is a small tube surgically placed directly into the child's stomach. This tube can deliver important nutrition for children and will help them grow in a healthy way. The child's parents, healthcare provider, and your child care health consultant will all support you and your team to know how to care for the G-tube, how to administer feedings, and what to do if it comes out. The child's healthcare provider will provide medical orders, and your child care health consultant will create a healthcare plan to give your team the proper steps on how to use the G-tube. Your team will also receive training, delegation, and supervision from your child care health consultant to ensure their comfort with the skills needed and a safe experience for the child. Supporting children with special needs and accommodations is important. Feeding children in meal times are an important time for children and their development. As the teacher or child care director, you can role model healthy habits, trying new foods, and normalizing children who may eat different foods. Sitting together, family-style dining, and positive eating experiences will help children learn to have a healthy relationship with food. For children with oral aversions, work with their healthcare team and therapist to create a plan specific to their needs. In addition to children with ASD, you may have children with other types of differences in your care. For some kids who have fine or gross motor delays or other types of musculoskeletal impairments, adaptive plates, bowls, cups, and utensils may be used as part of their therapeutic treatment plan. Using these special tools supports children's growth, their independence, and eating success. You will be working with their family and an occupational therapist as part of their healthcare team. Provide clear and consistent two-way communication with the child's family to create a mealtime experience that is stress-free and offers the child the opportunity to be nourished and experience growth. Some examples of adaptive equipment include cups with an adaptive handle, forks or spoons with extra large grips, or bowls that have a suction on the bottom. If you think a child might benefit from something like this, speak with their family about options. The information in this module is based on a variety of sources listed. It highlights key points relevant to this topic, but is not exhaustive. We encourage you to take a look at them for more information and to share with families in your care. Thank you for joining us to review Feeding Children with Special Healthcare Needs. This module is made possible by the Centers for Disease Control and Prevention and was developed in collaboration between the Colorado Department of Public Health and Environment, Colorado Department of Early Childhood, the Integrated Nutrition Education Program, Culture of Wellness in Preschools, Pikes Peak Community College, Front Range Community College, and Healthy Child Care Colorado.